Hi, my name is Ken Cyr, and we're going to be talking about the evolution of the healthcare supply chain as a strategic resource for the hospital.
Supply chain consists of several moving parts. How do you focus the complexity towards strategic goals?
We view all of the moving parts of the healthcare supply chain can be found in three core components. Data, which comes from all the various systems that are associated with the patient's continuum of care. Logistics and/or operations, which incorporates all the supply chain functions. And finance, which involves patient revenue and all of the individual financial transactions. By focusing on these three core components, we are able to see all of the moving parts not as disconnected tasks, but as aligned, integrated functions of the patient experience.
How has supply chain evolved during your career?
When I started in the business, we were focused on individual tasks: purchasing, receiving, storing, delivering, et cetera, et cetera. These tasks were disconnected from the clinical activity that created them, and we acted to events that had already occurred. It's kind of like driving your car by looking in the rearview mirror. Then we began to interface data between the systems. This was a huge improvement because we were able to see information that resided in each system. However, the data was not real time, it was batched. So the continuum of care from the clinical event through the supply chain event to the financial event was still siloed and reactionary. Now what we're seeing in the healthcare supply chain is a not so subtle shift from a focus on tactical transactions to a more strategic alignment with the organization's goals around creating and maintaining a patient-centered environment.
What will be required to achieve integrated process improvement in healthcare?
In their book, Advanced Lean in Healthcare, the authors discuss the concept of healthcare exceptionalism. And healthcare exceptionalism suggests that healthcare is too complex to apply the benefits of integrated and sustainable improvement that is present in industry today. And although in most cases that is true, we are beginning to see some improvement in that area. And this evolution is based on the patient's access to information. Today, the patient has access to more information than they ever have in the past. The patient can see information about the products, the cost of those products, and can even begin to understand the suggested cost for their care. And what this has done is it has helped healthcare organizations establish a patient-centered culture. Ultimately, the patient-centered continuum of care will depend on unrestricted access to data from systems, all of the systems that will engage with the patient experience. In addition, it will require a transition from a more linear, tactical, departmental communication to a more strategic departmental collaboration. It is this collaboration that will help break down the departmental silos and help the organization make decisions that are based on what is in the best interest of the patient instead of what is in the best interest of the department. The other part of that will evolve is that collaboration will demand an accelerated, integrated process improvement. And in that process, we will see the healthcare supply chain will not only become more involved in all of these processes, but it will be recognized as an integral strategic resource for the organization. This is Ken Cyr. Thank you very much for your time today.